On behalf of YWCA Rock County, welcome and thank you all for joining us online today. YWCA's annual Stand Against Racism campaign is a cornerstone of our national network's work to eliminate racism wherever it exists. The campaign is designed to build community among those who work for racial justice and to raise awareness about the impact of institutional racism. Powered by local associations like YWCA Rock County and partners across the country, Stand Against Racism unites communities to educate, advocate, and promote racial justice. In celebration of Stand Against Racism, the Rock County Board of Supervisors has declared April 22nd through April 25th of 2021 Stand Against Racism Days in the County of Rock, and encourages residents, local businesses, educators, and community and faith-based organizations to celebrate diversity and advocate for the elimination of racism. The cities of Beloit and Janesville have recognized April 22nd as Stand Against Racism Day also. Our Stand Against Racism theme is Racism is a Public Health Crisis. Institutional racism refers to the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, transportation, media, healthcare, and criminal justice that in turn reinforce discriminatory beliefs, values, and distribution of resources. Racist practices resulted in inequitable, depressed communities, which continue to negatively impact educational achievement for people of color, who are more likely to live in areas with underperforming school systems, access to nutritious food for people of color, who are more likely to live in areas with an abundance of fast food and without grocery stores or a food desert, economic security for people of color, who are more likely to live in neighborhoods with less access to traditional banking institutions and high numbers of payday lenders. Rates of environmentally based health problems for people of color, such as lead poisoning and asthma, due to living in neighborhoods with older buildings and greater proximity to pollution causing industries, resulting in rates of chronic diseases, including asthma, which are significantly higher in communities of color. Rates of infant and maternal mortality for Black and American Indian, Alaska Native mothers and children due to living in geographical areas with less access to health care and resulting in mortality rates higher than that for white infants and mothers. Now, we are so pleased to have Ian Hedges. Ian is the Chief Executive Officer of HealthNet of Rock County as our keynote speaker. HealthNet of Rock County is dedicated to excellence and innovation in the provision of primary health and dental care and health education, delivered free or at low cost to enhance the quality of life for the underserved residents of Rock County.
Hello, my name is Ian Hedges, and I'm the CEO for HealthNet of Rock County, our county's only free and charitable clinic. I am here to talk about YWCA Rock County's Stand Against Racism event, addressing racism is a public health crisis. Racism has been so prevalent within our medical system that it has now become a public health crisis in our county, in our state, and in our country. While there are specific and obvious examples of this today, we can look back 60 years ago at a Black woman named Fannie Lou Hamer, who went to the hospital for a removal of a small uterine tumor. Instead of receiving necessary medical treatment, the doctor performed a hysterectomy, and Miss Hamer was forcibly sterilized without her consent. Miss Hamer discovered this had happened to her as a way to give practice to medical students, and that this had occurred to more than 40,000 poor Black women in the South. In fact, it was so common, it was often called a Mississippi appendectomy. While many think that we are so far removed from this example of our medical system's history, Unfortunately, racism in medicine and our unconscious biases play a role into racial disparities even today. Especially with COVID-19, these disparities are increasing even more so. Here in Wisconsin, Hispanic or Latinx residents had 1.7 times greater case rates than white Wisconsin residents, while Black African American Wisconsin residents had 2 times greater hospitalization rates compared to their white counterparts. Even more troubling, American Indian Wisconsin residents had 1.6 times greater death rates than their white counterparts in Wisconsin. Even with Wisconsin impressively leading the country in administering the COVID-19 vaccine, the disparities of vaccinating non-white residents continue to be a cause of concern. We are seeing that more than twice as many white individuals have been given the opportunity to be vaccinated than Black or Latinx individuals. But racism in the medical system does not just show up in numbers. It shows itself in the words and rhetoric used in order to chastise entire groups of individuals. Words you see and hear used in the media by government officials, regardless of their political party, and even within clinic and hospital walls. A recent example of this is seen today with the increased violence and hatred against individuals of Asian and Pacific Island descent. This has led to misplaced blame and hurtful rhetoric that has only increased since the beginning of the COVID-19 pandemic. While we may have the right to speak our minds, we must keep in mind that our words can have consequences. Our words can ripple to actions that then ripple to what becomes the damaging realities of racism in our medical system. The violence we've recently seen towards Asian Americans and Pacific Islanders has spiked and resulted in fear of leaving the house to get COVID-19 testing, which causes the underreporting of symptoms. This has caused a higher death rate of Chinese Americans compared to white Americans. Additionally, nearly a third of the nurses who have died of COVID-19 in the US are Filipino, even though Filipino nurses only make up just 4% of the nursing population nationwide. If we allow the standards of care to be diminished for one group of individuals, we risk having it diminished for everyone. If we allow poor treatment of any race or ethnicity in the healthcare system, we risk having that same treatment occur to our parents, siblings, or our children when they are suffering from serious illnesses. Properly protecting others protects ourselves and the future of our community. We can steer our community to become more equitable and just. First, we must hold all of our healthcare and human service institutions accountable, including the ones who are part of our county, state, and federal government. Just because we provide a service to improve one's health does not mean that all can utilize it. In practice, the proportion of patients each of us serve should reflect the proportion of each racial demographic that lives in this community. If the number of patients in one or several racial demographic groups is not reflective of the community as a whole, we must ask why that is the case. Have we caused instances of mistrust? Are we unintentionally putting up barriers for minority communities to not use or access our services? We must recognize our past failings and provide specific ways that we will correct these actions for us to rebuild a trusting and accessible relation with different minority communities. Second, it is important that all healthcare and human service organizations, leadership positions, have individuals of color within them, whether it is in their senior administrative leadership or on their board of directors. We should also do more to recruit healthcare providers of different race and ethnicities to work in our organizations so that diverse community members can develop more comfortable relationships with healthcare providers who understand them. This requires time and investment and isn't as simple as just putting a position out in the open that minority communities might not even feel welcomed applying for. Recruiting from historically Black colleges and universities or professional associations for different minority groups is a way to show investment in these communities. COVID-19 became a public health crisis because we failed to prevent infections. We may have visited others while we unknowingly had the virus, or we may have not worn a mask in public. We now know that these actions had a devastating consequence in controlling the spread. Over the last year, we had to reevaluate each aspect of our lives because of COVID-19. We had to ask ourselves what we were willing to sacrifice in order to stop the spread. Just like COVID-19, we as individuals, organizations, and systems need to re-examine our unconscious biases. Talk to our children, neighbors, and coworkers about the consequences of racism. Think about what you can do and choices you can make today and beyond to protect communities of color from this ongoing pandemic and stopping this virus. When community members took the time to think about what they could do throughout this COVID-19 pandemic, it yielded many positive results. Folks in Rock County came together to make masks for individuals to wear and distributed them at essential community sites. Many businesses and organizations pulled together funds to give to the community organizations that were on the front lines of the pandemic, continuing to provide necessary services to meet the needs of Rock County's underserved groups. If we continue to ask ourselves what we are going to do to stop the spread of racism individually and collectively, hopefully it will translate into actions that form a more equitable community. Thank you, and HealthNet is very proud to stand against racism.
Thank you so much, Ian, for that informative information. We will now view a portion of a discussion between Dr. Ron Watson, Associate Professor of Health and Society and Political Science, and our Racial Justice Director, Amy Levy.
Thank you so much for joining me. I am so excited to have this conversation with you. As you may know, every year YWCA USA gives us our theme for each of our local Stand Against Racism events. And this year, our theme is Racism as a Public Health Crisis. So I have a few questions and we'll kind of see where the conversation goes.
Okay, sure.
Racism is a risk factor for toxic stress.
Right.
A root cause of some of the most harmful, persistent, and expensive health challenges facing our nation. What are some of the links between toxic stress and diabetes, hypertension, and infant mortality?
Sure. Well, first of all, I am absolutely delighted to be here to be a part of this conversation. And thank you for already this extraordinarily good question. Yeah. So when we think about toxic stress, we have to start first by asking, of course, where does it come from? And it comes from a variety of different areas of our lives, and it can come from our immediate environment, of course. But racism always is the sort of consistent factor in the toxic stress that certain groups of individuals experience. And so, you know, the conditions that you've brought up are really sort of indicative of that. So let's just start with diabetes. You are probably aware of this, but even if not, I'll say this anyway. So the Pima Indians out in Arizona, they have the highest incidence of diabetes in the world. And so you ask, well, why? Why is this a thing? And then you look at the way in which their way of life was effectively destroyed through the development of Arizona and the restriction of water resources. And it suddenly makes a great deal of sense. And not to mention, of course, the sort of existential, like literal existential stress and threat of survival that comes about not only because of the reduction in water and hence the ability to grow crops, but also because of racism against their group. And so it becomes sort of easy to understand how this comes about. There's if you've ever watched the Unnatural Causes video series, and if you haven't, it's a little bit long in the tooth now, as they say, but it's an excellent series that talks about this and why why diabetes became prevalent in this community. I mean, at one point they had no cases of diabetes, and then suddenly they had several, and then boom, right? And it sort of coincided with the loss of water resources. But it's not simply the Pima who experienced this. If we look around at communities worldwide who have experienced a great deal of oppression or other sorts of marginalization, we see higher rates of diabetes. Now, of course, diabetes isn't limited only to those groups, but we're talking about a higher prevalence. And in some cases, as in the case of the Pima Indians, a much higher prevalence. When we move on to hypertension, of course, is a disease that we see, a condition that we see very frequently among African Americans. And again, we suspect that this has to do with the absolutely toxic stress of racism, generation after generation after generation. And there are any number of scholars who've really started to understand that we can't think of the conditions in which a person lives as these very finite set of circumstances, right? So you experienced a great deal of stress, and then that's over because you had a child and everything moves on. Like, no, that's not the case, right? We are really starting to understand that this stress can actually create a sort of generational effect on folks through a process that we tend to think of as epigenetics, right? So it's not quite genetic, right? It seems kind of genetic, but this stress, especially if it is consistent over time, seems to be able to flip certain genes on or off that can lead to some of these conditions, or a higher prevalence of some of these conditions. And then, of course, there's infant mortality. And in the United States, we have seen that infant mortality rates for infants born to Black or African American mothers tend to be on average double, and sometimes in the last 15, 20 years have even been triple nationwide, what we see for infants born to white mothers. But while that has improved, I mean, we're still seeing a rate that's, over twice the rate of infant death. And that too, we think, is attributable largely to low birth weight and prematurity in African-American infants, which we then tie back to this chronic stress that their mothers are experiencing. And that's whether they're experiencing something that we think of as called weathering, right? Meaning that Black women, because of the chronic stress in their lives from the time that they are born, are simply older internally than they should be, right? Or if it's because of something else, which is the idea that these high levels of adrenal hormone, right? Cortisol and other adrenal hormones that sort of stay in the system and are constantly activated because of chronic stress, that these are maybe perhaps somehow leading to this pressure and stress on the body of the mother. And that stress is telling, if there's a fetus growing there, it's telling everything about that, telling that fetus, it's time for you to leave. You've got to get out of here, right? Something is wrong. And that may be leading to the higher levels of prematurity. So again, it's the toxic stress is tied to these adrenal hormones and their sort of constant presence in the body. And that's what we think may be behind these conditions, right? But of course, fundamentally, you ask again, where's that stress coming from? And it's coming from the extraordinary levels of racism and discrimination that we experience in the United States, and that some communities across the world experience.
All right, my next question. Let's talk about racial disparities in diagnoses and treatment of pain and other ailments.
Sure. So this has been one of the most troubling areas for me once I started to recognize this and of course pay attention to this work. The Institute of Medicine really sort of rang the alarm on this back in the early 2000s with their excellent documentation of this in a publication called Unequal Treatment. So for those who maybe aren't knowledgeable about that or don't know much about it, I highly recommend that you find it. You can find it fairly easily through a Google search, but it's called Unequal Treatment. And that's where they really started to get into this idea of why are we seeing these differential outcomes especially among African Americans vis-a-vis white physicians. And there are any number of reasons that are at play. And I think if I'm remembering correctly, the report really says, we don't think that there's overt racism happening here, which in some respects for me is actually far more disturbing. Right? Because what it suggests is that people are doing things without intention, and there are some other studies that also suggest something similar. So I'm thinking, for example, most of the studies that I've seen that find some sort of racial differential in treatment, they find things like this: that Black women, if they have a white male physician, they are the least likely to be properly diagnosed or to receive the pain medication that should have been the standard of care. Sometimes we think that maybe physicians are having this idea that, oh, well, we want to give something, a treatment plan that this person can stick with, for example, right? But that instead of thinking about class markers, right, or other sorts of ways of saying if this person is going to be able to stick to this regime, that they're simply using race as this immediate heuristic, right? Oh, they're Black, so they won't be able to go to the doctor. So maybe I need to do this instead, right? Instead of actually saying, well, do you have a car? And asking these questions. Now, part of that is perhaps a function, partially at least, a function of the shortness of most doctor visits, right? But the fundamental heuristic, right, that race equals all of these things, is obviously fundamentally at play there. But again, not intentionally. Interestingly enough, when we talk about pain medications, there have been some studies that show a difference between white male physicians and white female physicians, right? And that's, again, interesting to me, with white male physicians less likely to prescribe the same sort of dosage or the same sort of number of pills for pain management to Black and other, but particularly to Black patients. But with their white female counterparts, more likely to prescribe more medication to their Black patients. So that's again, there have been some studies that have shown that that's an interesting difference as well. But I would say, especially for someone like myself, I'm about 50, and so you ask the question, well, okay, these things happen in the past, and maybe to the extent that some of these physicians are older people, right? Maybe that's part of what's going on, is that they've got these sort of weird ideas in their head about pain and so on and so forth. But there are a couple of things that really sort of counter this. One is the opioid epidemic, the opioid crisis that emerged. Those of us who were paying attention to the numbers, we saw a very odd phenomenon when this crisis really broke, which was that we were seeing lots of mortality among white individuals, okay? And we said, okay, well, Black and brown people have been using heroin and such for years. What's the situation here? What's going on? And then as we started to trace this back, what some folks were finding is that some of this, or a good deal of this addiction that was leading to higher levels of mortality among white patients and white users was actually because they had started out on pain medications, right? Now, this is what's fascinating about this, is that there's this argument that maybe what was happening there is because Black patients were less likely to be prescribed opioids because of this unconscious bias, right? Or this idea, well, we don't want them to become addicted. They may become, more easily addicted, that they were actually being prescribed less. And hence, when the opioid crisis broke, right, just sort of you ran out of your pills and now you got to go to the street to figure out how to get the same pills. That this is why we initially saw this racial difference. In one of the first areas ever in the United States where we saw a health disparity in which whites were at the higher level. We also see it in suicide, right? But one of the very few public health areas where we could say that there was, clearly whites were suffering more for this initially. Now, of course, we've seen that gap vanish. But let me just back up for a second, because again, the most disturbing thing for me is that younger physicians, younger medical students in particular, may actually continue, especially if they're white, continue to hold these very strange beliefs around about Black people and their tolerance of pain. And that may be what is helping to continue this disparity. The University of Virginia did a study, gosh, I'm thinking it must have been about 5 years ago now, where they asked a number of students there about various beliefs, of course, false beliefs about Black people, including do Black people have thicker skin than whites, right? I mean, literally thicker skin, right? And do they feel pain less? And they found some disturbing numbers there, right? A disturbingly high number of white students, and including medical school students, held these beliefs, right? Said that at the very least, yeah, it may be possible that Black people have thicker skin or feel pain less than white people. Of course, we don't, because that would be a superpower, and we don't have superpowers. But nevertheless, again, one has to ask, well, what is leading to these beliefs? What is causing this? And one of the arguments I've been trying to build with folks in conversations, at least, is that I think that one of the effects of racism, of American-style racism, is actually that it has helped to diminish the ability of many white Americans to empathize with non-white people. You think about, for example, and I'm sure we'll get to talking about this too, whenever some incident arises because of police violence, you have African Americans and others going, "Oh my God, why did they shoot him? This is ridiculous." And then you'll have, in almost every case, a white person say, "Well, what did he do? But why didn't he comply?" Right? I mean, it's the most extraordinary thing if you actually think about it, right? Like, okay, well, an agent of the state has killed someone. Your first concern, wouldn't it ordinarily be about the person that was killed or about their family? My God, right? Their family. But what I'm arguing is that racism has really undermined in a very fundamental way the ability of many white Americans, not solely them, but many of them, to empathize with, particularly with Black folks, but with non-white folks more generally. And again, what is my evidence for this? These differences that we see in prescribing, even the more positive one, or that we see in treatment. Again, studies have shown that, a Black woman comes in, she's like, and they use actors for these studies, right? She's presenting the exact same symptoms that her white counterpart is presenting, and yet she ends up with a different diagnosis, right? Here's the thing: we don't see those differences among non-white physicians, period. And so it is absolutely suggestive of something else happening there, which again, for me, is fundamentally disturbing, because I don't think they mean it. They're not doing this intentionally, which is, again, in some ways even scarier, because it means you don't know who holds these beliefs.
Black, Latinx, and other people of color are dying at higher rates because of systemic racism, racial injustices created by social inequities in housing, transportation, education, healthcare, and public safety. What conversations do we need to be intentional about having in order to educate ourselves and position ourselves to be in positions to demand change?
So, yeah, I mean, the last part of that question, I'll start with first, right? How do we need to position ourselves to demand change? We need to do everything we can to make sure that we are, especially given to the extent that we are in a democratic society, that we are showing up at the polls and voting for those individuals who are willing to address these issues, because these are all policy amenable, right? Meaning that policies can, and changes in policy and the creation of new policy can come at these and can fix these. But it's not going to happen if people don't show up to vote. That also means that everything must be done to counter the anti-democratic behavior that is happening in a number of states. And Georgia is in the hot seat right now because of this, but they certainly aren't the only jurisdiction that's attempting to sort of limit people's access to the polls. I would also say that this is another one of those areas. Again, I'm a political scientist, and so I recognize the importance of being able to participate in governance. Is that this is another one of those areas where we need to revisit these attempts to, well, not even attempts, but the elimination of the right to vote, the functional elimination of the right to vote among many people who have felony convictions. There are only 2 states in the country that don't take away your right to vote when you become a felon. And I think we need to, that's something that needs to be revisited as a nation. Then why do you do that? You shouldn't do that. Because oftentimes many of the conditions that we experience, the so-called social determinants of health that are at play here, they are experienced most acutely by those folks who have felony convictions or are surrounded by people who are unable to get work because of prior criminal records and so on and so forth. But some of the, so I'll say that, right, is that at the end of the day, we need to make sure that we are mobilizing people to vote for political candidates who are willing to address these issues in a policy positive way. Now, what are the sort of things that we need to pay attention to? I think part of it is whenever there's a hospital or a clinic closing in a community, we have to be willing to see more than just that closing, more than just the sort of baseline economics of why that decision is being made. There are any number of cases, and I'm just thinking about some things from a number of years ago, where hospital closings in New York basically led to folks who had been relying on those hospitals to suddenly be like, okay, well, the closest hospital for me now is, 20 miles away. What am I supposed to do here, right? Especially when folks have the kinds of transportation and other sorts of limitations that we all sort of know about, right? Especially if you grow up in a relatively impoverished household or around people who experience poverty. We all know the sorts of issues that they encounter, trying to find rides to get to places, trying to take the bus, public transportation in a country that clearly still does not value public transportation in a very robust way. I think we also need to think about things like Medicaid versus the acceptance of Medicaid. That's a conversation we need to think about. I'm reminded of the young man who was about 14 years old now, probably about 10 years ago now. And if I'm remembering correctly, in Maryland, who had Medicaid, but he had an abscess tooth that ended up killing him because around him there, his mom wanted to take him to a dentist who would see him, but no one would accept Medicaid. And by the time she went through all of the procedures to get him seen in another state on Medicaid, it was too late. So we have to think about that, right? It's not enough to say, well, they're on Medicaid, well, yeah, but Medicaid isn't accepted everywhere for a variety of different reasons. And part of that, though, has to do about the reimbursement rate for Medicaid. Depending on where you are or what state you're in, that can be relatively low if you're a physician, right? And so it limits the number of Medicaid cases that a physician or any other medical professional, including dentists, it limits the number of Medicaid patients they're willing to take. I mean, to the extent that it's a private business, if one can understand this, right? So yeah, I mean, I think that's another conversation. We also have to really address the issue of trust. I think it's still difficult for many folks to understand that the communities that we're talking about, when we talk about, particularly about Black and Latinx communities, but also our American Indian communities, there's a great deal of distrust of the medical establishment for absolutely valid reasons. Even today, right? We've been talking about how people are I say accidentally, but unintentionally even mistreating some of these people some of the time. And so when you combine that with the historic experience that some of these communities have had in areas, everything from the instrumental use of their bodies for medical experimentation to even the sort of, forced sterilizations. And these are not situations in some cases that happened in ancient history. I mean, the forced sterilizations I'm thinking about, that's 10 years ago in the California prison system, right? So there's we're not talking about things that are ancient history. We're talking about things that are still living in the minds of some folks. I went to graduate school with a colleague who was from one of the American Indian tribes in the area. And she recounted to me how she and her husband, they wanted to have a big family. They wanted to have 5 children. And every time from her first child, every time she went in to give birth, she was asked, so do you want to get your tubes tied? And she was like, no. Why do you keep asking me this? Like after the 3rd child, she's like, why are you asking me this? We're not on public assistance. What is going on here, right? But again, these assumptions that people make about who you are and what you should or should not be doing because of your racial and ethnic identity. I think this is another one of those conversations, and how that impacts trust. And then, of course, we've all heard about food deserts, and there are a few other terms for these now. And employment. You can talk about employment deserts as well. We have to think about the ways in which the availability of healthy food and the availability of healthy employment, how these matter for people's health and their well-being.
All right. Final question.
Okay.
The American College of Physicians has found that Black individuals in particular are at risk for being subjected to discrimination and violence against them because of their race, endangering them and even costing them their lives. Share with us your thoughts on police violence. Unfortunately, we have several recent incidences and its psychological toll on not just those that are intimately impacted, but all of us. You know, the releasing of the tapes, the viewing of the tapes, the being asked in social circles what you think about the tapes or a trial or a situation in general.
Yeah, I mean, I think you've really already started to hit on the impact that these incidents have. We're talking about police violence here, that these incidents have on those of us who are not the victim. Okay. And I mentioned this early on, but even, it's tough to be in a society where I see something happen, and because of the empathy that I feel, especially as a parent, I mean, I think about Dante Wright and Tamir Rice, and I mean, just the John Crawford III. I mean, the list unfortunately goes on and on and on. But as a parent, especially those younger folks, I like stop breathing, right? Especially when the situation is one in which I could easily see myself or my sort of nervous kids ending up on the wrong side of. Part of what I think is, and I'll sort of back up here, part of what I think is necessary for us as a society, beyond our obsession with using violence to solve problems, I think part of what we have to understand is that the fear response is likely to generate a variety of different outcomes in people, especially when we live in a society where, listen, there is a legitimate fear that we could be harmed. We, meaning African Americans, and particularly African American males, but African American women as well, can be harmed in a police encounter, especially if those officers involved are white. That is a hard thing to say, but it's also an even harder thing to have to grapple with and live with. I myself have been very fortunate, I should say, since I've come to Wisconsin, interestingly enough, in that I've had the limited interactions I've had with police officers outside of my work on the Police and Fire Commission have been good. My own personal interactions. And in fact, one was really, really good, right? And I thought, wow, this is how policing is supposed to be. But these incidents, they constantly ignore that when I'm scared, some people, when they're scared, they immediately say this. Some people, when they're scared, they cry. Some people, when they're scared, they run. And some people, when they're scared, they attempt to fight. And the idea that everyone is supposed to immediately comply when they're faced with deadly force, especially in a world in which we know that our lives are potentially at risk, is absolutely unreasonable. And I don't really have any other way to say that. I think it's absolutely unreasonable. I mean, I even think for myself, given everything that I know, if a police officer pulled a gun on what should have been a basic traffic stop, which of course, by the way, I completely almost always freak out when I have been pulled over. I have only been pulled over a few times as an adult, and yep, I'm sitting here and my arms are shaking. Everything is shaking, right? Yes, I'm afraid. And the fact that I'm sort of forcing myself mentally to just don't move, whatever you do, don't move, right? That's not right. And the psychological impact of that, if you just stop and think about it, is if you're a person who has a traffic stop and you're like, oh, well, I was speeding, okay, right? It's a completely different aftermath physiologically than me sitting there like, I have no idea what I've done wrong. Oh my God, is this my day? Right? It takes a while to come down off of that. And it's just, I think that's part of, I'm sort of rambling a bit because this is all very raw for me for a variety of different reasons. Like I said, as a father, I have all boys. And as they were growing up, especially my two oldest kids, as they were growing up, they weren't even permitted to even have water guns to play with, right? It's not even a thing. You can't touch those things. Oh, this is green, Dad. Nope, don't touch it, right? Because again, I have seen time and time again, these incidents go completely south. Oh, you sprayed water on a car. Oh, that was enough to have the person stop and try to harm you, right? Spraying water on a car, whatever the situation is. And of course, I have my own childhood experiences with extreme racism, and my even early adulthood experiences, having people throw bottles at me, almost hit me in the face, that sort of thing. And so I think that what we have to recognize is that these events, they obviously cause extraordinary harm to the people who are there at the scene. But even when violence isn't used against them, the unreasonable cases in which they are stopped, frisked, treated as though they are criminals, that has an absolute psychological impact, right? Because it means that, oh, you were close. If they had found anything, this could have been your day. And that undermines our ability to trust members of our government. It undermines our ability to believe that our interests and our care and our best interests are at the heart of the matter when we are in need. It also, and there's evidence to suggest this too, it also means that when these incidents happen, all of a sudden communities of folks who are empathizing with the victims of those crimes, they don't call the police. They don't. We saw there was one study that was done a number of years ago. Actually, if I'm remembering correctly, it had to do with Milwaukee, where the police had beaten this guy, within an inch of his life in Milwaukee. And then they looked at 911 calls from the community he came from after that. And the number drops off like this, right? Like no one's going to call the police anymore, which then of course feeds into this idea of, well, who do you call when there's a problem, right? Rightly or wrongly. And again, because I've had the great fortune of working with a number of police here in Beloit, I know that the police force here is filled with lots and lots of really good people who actually do care about their community, who do what they can always to avoid using violence. Again, we may look at the international, how things stack up internationally and say, well, we still are more given to use violence than say other countries are. But especially relative to what we see in the US, I bet my money on the Beloit Police Department to act properly if they're called. But it could not be clearer that this is not the case everywhere. And the both the sort of the empathy that I have, and I'm sure that people like you as well have, it means that I've got to take a mental health day sometimes. Quite literally, we saw even a professional baseball player did this the other day, right? When this latest killing happened, he was like, "Okay, I'm done. I can't. I'm not. I'm going to sit the bench today. I'm done. Not going to be playing the ball today." I myself have to confess, the other day, between these two most recent incidents, with the 13-year-old boy also being shot, I tapped out of doing any work the rest of the day. I'm like, no, I can't. Because I can't help but see my children there. I can't help. And again, what is the first thing people say? Well, what was he doing out at 2:30 in the morning? That has literally nothing to do with him being killed, right? It is not illegal to be out at 2:30 in the morning. And even if it's past curfew, that is not an executable offense, right? That's at best, it's a ticket, right? So, I think that this is one of those places where not only do we have to, as a society, grapple with why it is we are so willing to use violence against anyone, in a variety of situations where, when we look at policing in other countries, people who are known to be armed still somehow manage to be apprehended without being killed. And of course, we see that among certain individuals and certain groups in our society as well. Again, we see a clear racial bias here too. But we have to ask, well, what is the long-term impact of this? What we know about chronic stress suggests that the long-term impact is that I'm going to live a shorter life because of this, right? That I'm being vicariously harmed because of this, because I can't help but now be afraid, more and more afraid. And some folks say, well, that's why the media shouldn't talk about this. No, that's not the solution. That doesn't make any sense, right? We have to know when these incidents happen. But what it really means is that as society, we really have to rethink how and why we engage people so violently, and really call into question why it is that we seem to be, in so many contexts, given to expecting a Black suspect or a Black person we approach to suddenly develop some sort of monstrous powers to such an extent that they have to be immediately shot, or immediately pushed down to the ground and have a knee put on them, to maintain for nearly 10 minutes, right? Even after they have literally stopped moving. Why we have to do that versus, particularly some of the incidents that we've seen with white male, especially older white male suspects who have actually committed acts of violence.
This is kind of new. Typically, it's held in person,
Mhm.
but we adjust, and that's what we do. And so I'm just so proud that you could be a part of this. Thank you so much, my friend.
Thank you for inviting me. Take care, and I hope that everyone learns what we need to learn to fight racism in our society, because it is a public health crisis.
Thank you so much, Ron and Amy. That was awesome. Amy will now lead us in reciting our Stand Against Racism pledge.
Please stand for the Stand Against Racism pledge. Mindful of the continuing affliction of institutional and structural racism, as well as the daily realities of all form of bias, prejudice, and bigotry in my own life, my family, my circle of friends, my coworkers, and the society in which I live, with conviction and hope, I take this pledge, fully aware that the struggle to eliminate racism will not end with a mere pledge, but calls for an ongoing transformation within myself and the institutions and structures of our society. I pledge to look deeply and continuously in my heart and in my mind to identify all signs of vestiges of racism, to rebuke the use of racist language and behavior towards others, to root out such racism in my daily life and in my encounters with persons I know and with strangers I do not know, and to expand my consciousness to be more aware and sensitive to my use of overt and subtle expressions of racism and racial stereotypes. I pledge to educate myself on racial justice issues and to share what I learn in my own communities, even if it means challenging my family, my partner, my children, my friends, my coworkers, and those I encounter on a daily basis. I pledge, within my means, to actively work to support public policy solutions that prominently, openly, and enthusiastically promote racial equity in all aspects of human affairs, and to actively support and devote my time to YWCA as well as other organizations working to eradicate racism from our society. YWCA USA is on a mission to eliminate racism and empower women. I join YWCA in taking a stand against racism today and every day.
We invite you to comment on our Facebook page. Please visit our website at ywcarockcounty.org to print a Stand Against Racism sign and post your selfies. If you don't have access to a printer, we encourage you to make your own sign and remember to share your photos with us. Our collective efforts can root out injustice, transform institutions, and create a world that sees women, girls, and people of color the way we do: equal, powerful, unstoppable. We look forward to seeing you in person next year at either the courthouse in Janesville or Riverside Park in Beloit for Stand Against Racism. Please stay safe, commit to physical distancing, wear a mask, wash your hands frequently, and remember, stand against racism.